Welcome to The Explainer. Today, we're talking about an experience that is absolutely universal for half the population, but we're going to look at it through a new, much more urgent lens. We're diving into menopause, but not the one you think you know. We're going to uncover the hidden story that's been ignored for way too long.
So let me just ask you, when I say the word menopause, what's the first thing that pops into your head? For most of us, it's probably a handful of very specific and very well-known symptoms.
Yeah, you're likely thinking of these, right? The classic signs that really dominate the whole conversation. You know, the hot flashes, the night sweats, the mood changes. They're absolutely real, they can be incredibly disruptive, and they are what most people associate with this phase of life. And as it turns out, that experience is almost universal.
I mean, how common is it? A staggering 84% of women report having these kinds of issues. So it's a nearly universal part of the process. But the story does not end there, not even close. In fact, this is just the beginning.
And this brings us to this really powerful idea that just flips the entire conversation on its head. The symptoms that are the most annoying, the most visible, the ones that bother you, they are not the ones that are the most dangerous.
And this, right here, is the core of the whole problem. You got to think of it like an iceberg. The symptoms you feel, the hot flashes, the aches, that's just the tip. But underneath the surface, silent and way more dangerous things are happening. We're talking about atherosclerosis, which is your arteries hardening, a loss of bone density, which leads to osteoporosis, a much higher risk of stroke, and even cognitive decline. These are the unseen killers that are developing without you even knowing it.
Which, of course, leads to the big question. If the long-term risks are this serious, why in the world is there such a huge gap in awareness and care? Well, the answer seems to reveal this devastating two-part failure in how we approach this.
So for part one, let's take a look at the medical system itself, because the data shows it's just critically unprepared to deal with a transition that affects literally half the population. And this statistic, it is pretty shocking. 2/3 of postgraduate medical programs, you know, the places where we train our future doctors, don't include menopause in their curriculum at all. It's just not taught.
So what about that 1/3 of programs that do cover it? Well, the instruction is minimal, to say the least. We're talking about a maximum of just 2 hours of training, total. And those 2 hours are often broken up and scattered across totally different departments. It's treated like an afterthought, not a critical field of study.
The result of that huge training gap? Well, it's predictable, but it is no less alarming. An overwhelming 80% of medical practitioners say they do not feel adequately trained to manage menopause. Only 1 in 5 feels ready to help their patients navigate this.
And this lack of training, it leads directly to a lack of agreement, what some call a confusion of experts. Think about it. A patient might see their cardiologist, their gynecologist, and an endocrinologist and get 3 totally different, even conflicting pieces of advice. All that does is create confusion, mistrust, and, in the end, people do nothing.
Okay, so that's the system. But the second part of this failure, it isn't just happening in the doctor's office. It's really embedded in a broader culture of silence that stops women from seeking and receiving the proactive care they desperately need.
I mean, just look at the gap here. It is staggering. We know that 84% of women are having symptoms, but only a tiny fraction, just 10%, are actually seeking proactive care before those symptoms even start. The huge majority wait until the problems are already happening. And this is just tragic, because there is a massive window of opportunity here. We're talking decades, from about age 35 to 60 for education and for prevention before those silent killers like heart disease and osteoporosis become irreversible clinical problems. We are just missing this critical window. So you have to ask, why? Why the silence? Well, the reasons are pretty complex. A lot of women just don't connect the dots between other health issues, like their blood pressure creeping up, and menopause. Many have no idea that effective solutions exist to manage both the symptoms and those long-term risks. There's also this deep-seated belief that it's just something you have to grin and bear it, just endure it. And what's really shocking is that many women even stop other vital preventative screenings, like for cancer, during this time. All right, so knowing the massive scale of this problem, an unprepared system, and a culture of silence, what's the path forward? How do we even begin to fix this?
Well, the good news is the path forward can be broken down into a pretty clear 4-step approach. It all starts with education, right? Raising public awareness about the real long-term health risks. Then it's about dialogue,
normalizing these conversations so it's no longer some taboo topic. Third, we absolutely have to mandate better training for our healthcare professionals. And finally, empowerment, helping patients become proactive advocates for their own long-term health.
So ultimately, the takeaway here is crystal clear. We have to stop looking at menopause as just some uncomfortable phase or, an end point. We need to reframe it as what it actually is, a critical, predictable health transition that, if we manage it proactively, can protect a woman's health for decades to come.
And so we're left with this one question. Given that menopause is a universal biological process for half of all humanity, why is getting adequate, informed care still the exception and not the rule? It's a failure we simply can't afford to ignore any longer.